name is Catherine Price and I'm a physical therapist. Today I'm going to do a workout routine to address lumbar disc health. Please contact your doctor or physical therapist for the appropriateness of the exercises for you, and please do not do any of these exercises if they cause you pain. First, I'm going to start with a scripture from Psalm 118:24. This is the day which the Lord hath made. We will rejoice and be glad in it. So today I'm going to do a routine to help with disc health. We're going to focus on the psoas muscle. The psoas is going to attach from the low back, the lumbar spine, and down into the inner part of the groin on a bone on the femur, the portion called the lesser trochanter. And that can pull on the back and compress the disc. So we're going to do a workout routine, the release, stretch, and strengthen. And so let us begin. First, we're going to start with a lacrosse ball, and I'm going to have 4 different tools today. A lacrosse ball, a weight, a roller. You can use a foam roller. I'm going to use a little harder roller, and then a exercise therapy ball. So the first thing we're going to do is release the abdominals. So I'm going to take the lacrosse ball, and I'm going to place them. So we're going to go, this is my rib cage. If you don't want to be on bone, I'm going to come right below my rib cage and not on the xiphoid process of your sternum. So I'm going to come just find my ribs and go on either side, and I'm going to go down the abdominals, and then I'm going to even get to the lower part. My psoas is going to be deep, so we're going to do some active release and work down that front line. I'm going to be focusing on the front line today. So I'm going to take the lacrosse ball. I'm going to place it right where I showed you, and I'm just going to sink down into that. Now I'm going to go side to side. That's perpendicular to the fibers. If I have an area of tenderness, and if I find that, I'm just going to hold there. And I'm going to work my way down. Again, going side to side. And even further down. So here I am on my left side. I'm going to do both sides. Now when I get really low, I'm going to be more close to my transverse abdominal muscle. And deep is going to be my psoas. So I'm going to lie flat with pressure on that lacrosse ball, and I'm going to actively release the left side. So I'm going to use my butt muscle to lift the leg and lower it back down. I don't want to be using my back. I want to be using my glute. My glute's going to stabilize the back. And I'm just releasing the front side. If I have pain on my back, I'm going to stop. And I'm just going to pump my leg up and down. 15 times or so is sufficient. Okay. Then I'm going to take the lacrosse ball and I'm going to place it on the other side, starting at the top, not on ribs. And I'm going to rock side to side, perpendicular to those fibers if I find an area of tenderness. And sometimes I have to investigate to find if I do have areas of tension, and working my way down. I'm running out of real estate, so I'm going to start back. Start a little bit lower. And here, once I get to the low portion, when I rock to the side, if I run into bone on the hip, the iliac crest, then I am going to be in the area of my transverse abdominal muscle. Again, deep to that is going to be my psoas. I'm going to lie flat, and I'm going to use my glute, my butt muscle, to lift the leg, and that's going to apply pressure to the front side, and that's going to release the tension in that area. So I'm just lifting, relaxed. Lifting, relax. Again, I'm lifting from my buttocks, trying to leave my low back out of it. It's hard not to have some contraction in the low back, but I want my stabilizing and my work to come from the glute muscle, the buttocks. Cultures that have little to no back pain have very strong buttocks. Okay. So once I release the tension there, I'm then going to stretch those muscles. So I'm just going to press up and hold. And I'm going to squeeze my butt to stabilize my back. If you're having pain with this, you do not want to do it. If there is a posterior ligament problem in the back or a disc injury, usually this feels good. And I'm going to hold for about 30 seconds. And I'm going to relax down. Take a deep breath in. As I exhale, I'm going to push back up and I'm squeezing my butt to stabilize my back. And I'm stretching through my abdominals and the front side of my body. If I look up, I should feel more of a stretch down the front line. And I'm going to relax down, take a deep breath. And as I exhale, I'm going to straighten my elbows, squeezing my buttocks to stabilize my back. And you can relax if there's no pain. You can relax everything and just hang out here, stretching the front side of the body. So this is going to stretch both my psoas as well as my abdominals. So we're working on the deep front line and the superficial front line. Okay. Next, I'm going to stretch my hip flexor, that psoas. One leg forward, one leg back, and I'm going to sink down and I'm going to hold this stretch. Ideally, if you're older, over age 30, you want to do a minute hold. 30 seconds is what I'll do when I'm first starting to try to loosen up a muscle. And then a minute is going to be more effective to hold that. I'm going to rock out of that. And then I'm going to lean back in. And if I'm not having any pain, I'm then going to start to come down on the inside. As I lean down, I should get a stretch on that opposite leg, not on the back leg. You should get steel in the front, but also on the upper part, inner part of the opposite leg. And as you can bring your elbows down only if there's no pain. If it's an active disc injury, you're going to want to not go into any flexion right now, which is the forward bending, and you just want to hold this. I'm going to rock back out of that, and then leaning back in for a last stretch, sinking down, really getting the stretch through the front. And again, as I can, I'm going to bring my hands to the inside of my opposite foot and hold this, feeling a stretch both on the front side of my back leg and then the inner groin upper portion of my opposite leg. And then I'm going to rock out of that. Then I'm going to switch and I'm going to do the other direction. I'm going to lean in, feeling a stretch on the front of the back leg, and hold this. Ten more seconds. And I'm going to rock back out. Going back in for another stretch. If you're having back pain, then you don't want to stay and hang out here. And you want to readjust so that you can position yourself where you're not having back pain. And then as I'm able, I'm going to work my hands down, and I'm going to hold here, keeping a nice straight back. As I can get lower, I'm going to work on getting lower as long as there's no pain. And then I'm going to rock back. And last one, I'm going to sink down. If I take my hips and tilt them slightly backwards and get more of a stretch, again, you want to be pain-free in your back. This is going to decompress the back. It's going to stretch that psoas. As I'm able, I'm just going to walk my hands down, keeping a straight back. I'm going to come out of that. So that's going to be the stretch there. Then I'm going to get my roller, and I am going to roll the front part of my legs. So I'm working on the anterior line. And the tensor fascia is a hip flexor, and so I'm going to lean slightly to my side all the way to the top of the hip. I'm just putting increased pressure on that. And then I'm going to switch to the other side. I'm just slightly rolling so that I'm on the front, but almost to the outside as I go up to the hip. That's going to get my tensor fascia lata muscle. It's going to be a hip flexor. And I want to roll the front line, because next we're going to just progress the half kneel stretch and add a rectus femoris, or a hip flexor stretch that's going to be a little bit more challenging. And then I'm also going to stretch the adductor, so I'm going to just roll my legs so that it is turned outward. And I'm going to go on that inner part of my thigh. And releasing tension on the adductors is then going to allow me to stretch them, but also get into my iliacus portion of my iliopsoas, so we can get the hip flexor further stretched. Same thing on the other. I'm just going to place this with my foot turned out, leg turned out, and roll the inner thigh. Any areas that are tender, you can hang out there. Let that tension just release. It takes usually 2 or 3 minutes for the fascia to loosen. I am rolling too fast, so you do want to roll much slower. If you're having any back pain, don't participate in any of these. Okay. Now that I have rolled the front line, I'm going to go back to stretching. Again, our rule of thumb is release, stretch, and strengthen. I'm going to go back into that half kneel position. This time I'm going to reach behind me, and I'm gonna grab my foot. You can prop your foot up on something, on a wall, so that you're not reaching back to grab your foot, or you just have it supported, and you're gonna get a deeper stretch in the front side. So I'm just gonna hold that. And I'm gonna rock back out. And leaning back in, grabbing my leg, holding here. And rocking back out. You can hold these a little bit longer. A good 30 seconds to a minute's a good stretch. And then relax. I'm going to turn the other direction. And I'm going to do the same thing here. I'm going to bring that heel up towards my buttocks and hold this, feeling a good stretch down the front side. Should be having no back pain. If there's back pain, please do not do this. And rocking back out. I'm going to go back in, reach for my foot, bring it to my buttocks, hold. And as you're doing this, you can take deep breaths, trying to pull from the bottom of the ribs. And exhale completely. You want to mobilize that diaphragm, stretch it, engage that muscle that's attached to your hip flexor, your psoas. And so if your diaphragm is tight, it's going to pull right into the hip flexor muscle. So deep breaths are beneficial. And leaning forward, I'm going to grab my foot and heel up towards your buttocks and hold right here. Taking deep breaths. And then our last stretch is going to be our iliacus and adductor stretch. Just if you have a table you want to prop on, the back of a couch, you can, so that you're decompressing the back as you do this, but you're just looking for a stretch on the inner thigh. And with a disc injury, you want to stay upright as much as possible. You can lie on your back, you can put your feet up against the wall, and also get this stretch this way. And here I want to do 3 times 1 minute. If you're not having back pain, you can work on getting further and further. I am going to lean forward so that I can get a deeper stretch. And then I'm going to relax out of that. I'm going to go right back into it, placing my feet on either side, letting my body sink down. And again, I'm going to support with my hands. And I'm going to come down low. And I'm keeping a straight back. And I recommend doing one more for the sake of time. I'm going to move on for core stabilization. So I'm going to then get into a quadruped position. I want to keep my back neutral, my knees underneath my hips, my hands underneath my shoulders, and then I'm going to alternate leg and arm 10 times. 2, 3, 4, 5, 6, 7, 8, 9, 10. Then I'm gonna extend my left leg, right arm 10 times. I'm keeping my navel to my spine, keeping my back and my core contracted, not my back, my core, my abdominals. My back is gonna contract as I'm controlling my limbs. 10, and come down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Opposite. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I've got one more set each side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and 1, 2, 3, 4, 5, 6, 7, 8, 9, one more, and 10. Next, I'm going to work on my extensors. I'm going to grab a pillow to put underneath my hips. So I'm going to place a pillow underneath my hips. I want to use my buttocks, not my back. I'm going to relax down. I want to squeeze my butt, and I want to lift my leg. 2, 3, 4, 5, 6, 7, 8, 9, 10. There should be no back pain. If there is, do not do this. 3, 4, 5, 6, 7, 8, 9, 10. One more set. I want to draw my navel to my spine, so I'm keeping my core contracted. 3, 4, 5, 6, 7, 8, 9, 10. And the right side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next, I'm going to do planks. Planks can be very stressful to the low part of the back when done incorrectly. You want to use your buttocks muscle to stabilize the back. I'm going to go onto my elbows, tuck my toes under. I want to squeeze my butt just as tight as I can. Bring my navel to my spine, and I'm going to hold here for 30 seconds. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Only if you're having no pain when you do this. If you sit back, you can decompress the back, open up the back. Take a deep breath in. Going back into plank. I'm going to squeeze my buttocks, bringing my navel to my spine, and hold here for 30 seconds. And relaxing down. Back into plank, tucking my toes under, squeezing my buttocks, navel to my spine. The last one. Bringing my navel to my spine, squeezing my buttocks tightly, holding here. You should have no pain. If you have pain, you want to come out of this position. I then want to go into a side plank. I'm going to stack one foot in front of the other, go into my elbows. I'm going to keep my navel to my spine. I'm going to squeeze my buttocks. And I'm going to hold here. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Switching to the other side. Same thing. I'm going to go onto my side. One foot in front. Holding here, squeeze your butt, navel to your spine. And resting. Switch one more each side. One. Squeeze your buttocks, navel to your spine. Relax. Okay. Next, I'm going to go ahead and work the lower abdominals. I'm going to lie onto my back. Okay. I want to find a nice neutral position. So just rocking forward and backward, finding center. I'm then going to take my navel, draw it down into my spine. I want to stay contacted to the floor, and I want to hold that. If I arch up, then I want to not do the exercise. I want to be able to engage my core, my lower abdominals, such that I can keep my hips and pelvis stabilized and they do not move. You can put one finger on each bone, the front of your hip here. Hold that, do not let it move. So I'm going to stabilize, engage, and then I'm going to lift one leg up, and I'm going to alternate back and forth to toe tap, keeping my back contacted to the floor. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and rest. Navel comes to your spine. Back stays contacted onto the floor. You're not trying to compress, you're trying to use the core to hold yourself still. I'm going to stabilize there, lift one leg and alternate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and rest. Then I'm going to, if you're having, you want to keep your spine neutral as you move. Sometimes I pop up and down. So I'm going to come back onto my back, place my therapy ball underneath my legs, and this time I'm going to engage my hamstrings So when you're engaging your hamstrings, then I'm gonna, and also use my lower abdominals. So I'm gonna bring my navel to my spine, pull in with my hamstrings, and then I'm gonna lift the ball. And I'm gonna do that 50 times. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and relax. So next, I am going to then get my weight, and I'm gonna go back into a nice cool lower abdominal contraction to stabilize my back against the floor, and then I'm gonna take the weight overhead and then bring it right back, keeping the back contacted on the floor. Your back, if you have tightness that goes from the shoulders down to the low back, your low back's gonna wanna arch, and you wanna keep the back contacted down. 10, I'm gonna do this 20 times, 11, 12, I may have miscounted, 13, 14, 15, 16, 17, 18, 19, last one, 20, and then I'm going to do an accordion, so I'm going to add the therapy ball to this exercise. So I am going to roll the ball up to my knees while I keep my back against the floor. 1, 2, 3, 4, 5, 6, 7, 8, back stays on the floor, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, last one, and 20. Now, if your back tends to want to come up as you're doing that, you may want to roll the lats before you do this. So I am going to go ahead and roll my lats. And so I'm going to go right on the edge of my shoulder blade along the rib cage. So it's going to run from the shoulder down to the low back. So I'm able to get some of that tension by applying pressure and allowing the connective tissue to relax and lengthen. And then I'm going to roll my other lat. And you can spend as much time as you need to loosen the lats here. After I do that, I'm going to go into a chair pose. So I'm going to keep my feet about shoulder width apart. And I'm going to bend my knees and keep my back straight, but not letting my knees go over my toes. As I bend my knees, I'm going to bring my arms up, and I'm just going to hold this position, bringing my navel to my spine. and I'm gonna feel my back contract and just hold this position. And then coming back up. And I wanna make sure that I'm not having any pain, getting that nice shoulder flexion, holding here, and then coming right back up. Now, a lot of injuries in the back can come from twisting, so you do not want to stress the ligaments. But if you are gonna go back to an activity that requires rotation, that you want to balance the rotation and still strengthen those muscles. So I'm gonna take my weight, I'm gonna keep a straight back, I'm gonna bring my navel to my spine, I'm gonna lean forward, activating the back muscles, and then I'm going to rotate equally from side to side and working on balancing those muscles as I'm controlling the movement with no pain. If there's pain when I do this, then I'm gonna stop. And you wanna go equal distance from side to side. And I wanna do this about 20 times. And one of the other things to focus on is anchoring those shoulders down. So I'm not going up, I want to anchor them down, and then I want to do my rotation. And that completes our stretch, our release, stretch, and strengthen for some core exercises to help with disc health. I hope you have a wonderful and blessed day. Thank you.